mental health isn't just one thing's going to fix all of those issues. It's going to take a concerted effort, it's going to take multiple different actions, it's going to require all of us to be able to contribute. My particular research is identifying some of those things that are more effective for Māori young people, and really alarmingly we've seen in the last 20 years a doubling of hospitalisations for mental health issues. Nearly 30% of Māori young people have significant depressive symptoms. This is not just feeling a bit stink, this is feeling really sad, and that should have some kind of clinical intervention. Yet there is no way that 30% of Māori young people are being seen in health services. Our child and adolescent mental health services, unfortunately, are only funded for about 3 to 5% of the worst mental health issues. So there's this huge gap where young people are distressed, young people are taking their lives, young people are really suffering but not getting the help that they need. You know, when I talk to young people, I say, well, you know, what do you want? They go, well, we don't want to sit in a room. We don't want to sit in there with someone wearing a stethoscope. We don't want to come to these appointments with people that we don't know who use big language and don't get us. And I'm like, well, so if we were to really redesign what this looks like, what would it look like? Let's stop looking at the problems associated with being Māori. Let's kind of look at what the strengths of Māori are. Cure Kids funding is allowing us to kind of really put some effort into child and youth mental health and go, this is really important. We really want to look at all the possible solutions that might work here, and we're really interested in making sure that our solutions are culturally appropriate. So for Māori, what are the factors that are going to work for Māori? If we're looking at children and young people being able to, get services, how are we going to do that better? So ultimately, this is a great opportunity. It is given in generosity, it is given in complete trust that, me as an academic, as a nurse, as a mother, am working in the best interests to try and find solutions that are going to work for everyone. I'm incredibly grateful for the funding from Cure Kids, is because really this is concerted money and energy that is being put into innovative projects that might not normally be funded. And so from my perspective, Cure Kids is taking a risk and sort of going, actually, we know mental health is really important to the future of children and young people in New Zealand. We know that mental health is one of those areas that is really suffering right now, but we don't have a whole lot of solutions in this space. We know these solutions aren't easy solutions, and so we are going to really invest in making sure that we've got top quality evidence that is really going to make the lives of children and young people much better. It's all about having those support systems, but it's also about making sure that we've got good housing, we've got good child poverty strategies happening, that we've got good health services. Ultimately, people are looking for connection. They want to be loved, they want to be seen, they want to be valued, they want to know that they're going to be able to contribute to the world. If we get in early and we treat and we support children and young people early, they're going to have much better outcomes as adults. As a wahine Māori who is a researcher, who is a mama, I want my babies to have these things. I want my mokopuna, my grandchildren, to have all of these things so that they can grow up being proud, loved, supported, and be who they want to be.